You are on track 3. In a few minutes, we'll start the panel, the triad of the post-pandemic, infrastructure, private sector, and economic recovery. Investments in infrastructure are of the essence for the economic recovery. They drive growth and generate jobs. And in order to be feasible, they will need the dynamic private sector, as the IDB Invest will show in this panel. We'll also see innovative financing structures and award-winning projects. The moderator will be the interim head of the infrastructure department of IDB Invest, Elizabeth Robberechts. Good morning. Welcome to our panel in PPP Americas. We'd like to thank you for attending our panel, and we are going to talk about the triad: private sector, infrastructure, and economic recovery. Our panel will show how infrastructure can be a motivating factor for economic recovery after the impact of the pandemic in our region. My name is Elizabeth Robberechts. I am acting chief for IDB Invest, which is the private investment side of the IDB. We have a very large portfolio of projects in the region, and we saw the impact of the pandemic on our clients that range from delays, new demands, licenses, authorizations, things that we try to address by supplying appropriate financial products. We are very pleased because we have very distinguished guests in our panel. And in order to talk about this theme of 3 different industries, first we have Patricia Santos. Patricia is the CFO of Albert Einstein Hospital here in São Paulo. It's a very prestigious Brazilian hospital, also providing education, health, innovation, and research projects. It's one of the main leaders in Latin America and leader in Brazil in the fight against the COVID pandemic.
Passenger volumes dropped about 61% from 2019 to 2020, and it's estimated that that recovery will not happen fully until perhaps 2024. So contrasting what the hospital has experienced, Fraport in the airport sector has experienced a dramatic decrease in demand and a number of passengers. We also have Daniel Temesio on our panel today. Daniel is a director with Saceem. Saceem is an Uruguayan construction company with more than 70 years of experience in providing engineering, procurement, construction, and construction management services for infrastructure projects in Uruguay, Paraguay, and Peru. In 2017, Saceem created its concessions unit, through which it actively participates in the concessions market and PPP markets, which is very, very active, particularly in Uruguay. Recent notable projects include the Ferrocarril Central project and the Educativa II project, both in Uruguay, as well as the Punta Lomitas wind project in Peru. So thank you all very, very much for being with us and for bringing your unique perspectives to the issue of the impact of COVID and the recovery through infrastructure. I'd like to start by asking you all to talk about, having a little bit of a therapy session here and talking about what was your lowest point in the context of the pandemic. We'll get to be more positive a little bit later on, but Patricia, can you start and talk about what was the lowest point that you felt at Albert Einstein throughout this pandemic?
It is difficult to choose a low point because the pandemic brings us a lot of challenge to management in hospital services. In the case of Albert Einstein, who works in both the public and private sector of various natures, the first very challenge point was that we did not understand what we needed security for our employers and our customers. So this was the first point, and at the moment we didn't know about the protocol and behavior of this pandemic. But at the moment it was totally difficult to make projections. We doesn't know when the system would go being overloaded with new cases, and the system overloaded was necessary for us to have direction to try to make these expansions. We made a lot of mistakes, and luckily we made more mistakes and we made a super capacity, and that after the second wave proved necessary. When it also happened in other countries. In Brazil, the second wave was much stronger than the first, and we used all that capacity. And to summarize, from the financial point of view, we had a collapse in some supply chains. In terms of personal protective equipment, masks, aprons, gel alcohol, we had to make a production in alternative suppliers, and mainly items that I used in ICU, such as long respirators and other equipment to give support in life. We had shortages all over the world, so this supply chain brought a huge increase in costs. So we lived, I can say, the perfect storm, because we had a thermometer drop, even in the hospital. At some point, even serious patients disappeared from the hospital, so we had a drop in revenue due to the lack of demand. We had an increase in costs. We had to make investments in this expansion of beds and care capacity. We had to hire a hand of specialized work, which was very expensive.
So the low point for me was in March 2020. So as head of finance, we were organizing a capital market transaction. And so over the past years, we were used to always, without any exception, to very successful transactions. Usually we had a large oversubscription in our transactions, so everything went fine. And so we had scheduled this transaction quite a while before we had a lockdown in Europe and in Germany. And so I think it was the last one before the market completely dried out. And we just completed it in line with more or less expectation. So we got it, we closed it, but nothing to write home about. So we just finalized this transaction. It is without any substantial oversubscription. At that time, we realized that things are about to change, so that the market or the sector will be hit dramatically, and so therefore, it was just a change in mindset up, so that we have to look at the things now differently, so that we have to start fighting now. So this was the starting point, the low point, but the starting point for new successful transactions at the time.
Thank you, Michael. Danielle, are you still there? There you are. Danielle, can you talk to us about how it was in the construction sector? And I have experienced you were working on the Ferrocarril project, I'm sure, as well as many others. What was the low point for you?
Point we should talk about what Uruguay was going through the pandemic. We declared the sanitary emergency, but the first problem in the pandemic, we started to see it in the first quarter of 2020. This was a preparation period, very important, as to neutralize the negative impact on construction and production. There were the uncertainty of something that was unknown, and we used the old prescriptions. We generated a crisis commission or committee, several people involved in terms of health, financial issues, in order to create the necessary protocols to be able, under reasonable conditions, because suspension, work suspension was carried out. We didn't see a very low production because of COVID. Thank you, Daniel. Gracias, Daniel. Ahora quiero también preguntar, usted ha mencionado, Patricia, que han visto problemas en la cadena de suministros, por ejemplo, los ventiladores. ¿Qué otros problemas en la cadena de suministros han tenido la parte de personal? ¿Cómo hubo alguna cosa que han podido realmente administrar y cómo han tratado esto?
The whole support chain
Toda la cadena de suministros
was
tuvo
impacted.
impacto.
The task force that the hospital Albert Einstein did for hiring more staff was excellent because our human resources manager, she wrote a book about it because we really had to mobilize a lot of people. The positive point was that a lot of people said, I'm going to go and work pro bono if necessary. So we had people that really went and they helped without charging and being paid for anything. But we needed people with that had to be ready. We had a hard time increasing the staff. We have 18,000 collaborators that work in the public and private sector. In a few days, we hired more than 1,500 collaborators. So it was a very intense production. And even at that moment, we were very uncertain about the health of these collaborators. Very quickly we learned that the protection items like masks were quite efficient to avoid the contamination. So human resources was a big challenge, and as I said, the supply chain in the world had difficulties. Brazil had a lot of difficulties for imports. The private sector was competing with the public sector, so this discussion between the universalization of service and the capacity of paying the private sector was very discussed. I'm not saying what was right, what was wrong, but this is something we had to deal with in the pandemic. And also, there was a lot of stress because everything had stopped. So our collaborators, they needed support. Even those that were hired, they needed support to be able to work in the pandemic. So what does that mean? There are some others that had their children at home, fathers who had elderly patients in their homes, and they had to either work, and that would be an additional risk. So we had to give support to some collaborators. We had a hotel available for them to sleep overnight without going home, because otherwise they were afraid of contaminating their elderly relatives. We signed a partnership with a school nearby, and they didn't have classes going on, and so they offered the space of the school where the children were working online, so that the parents could work. So we created solutions, very simple ones and very complex ones, to be able to serve this whole chain.
Daniel, in your case, I think it was very complicated for the construction industry. We saw infrastructure projects. Tell us how you managed that during that period, because you were dealing with huge projects with imported equipment. So what were the consequences and how did you tackle the situation?
The problem, we had the supply problem. An example, a very interesting example, we had to produce in Europe in a dormant factory 560,000 dormants, and then the factory was in Bergamo. That was one of the most affected cities in Europe, and this caused delays, important delays, in terms of the arrival of the dormants in Uruguay when we were building trains. We could reduce the impact. We reduced the impact in terms of schedule, and the factory adjusted their levels of production so that it could be aligned with the production plan. But there's no doubt that this has affected the supplies, delays of supplies, and also higher costs we had to pay for supplies because flights were not very frequent in certain areas. But solutions caused these solutions. Okay, we have paid higher costs than those that have been forecasted, but we didn't want to exceed a certain number. And this is the logical consequence of problems we had during the pandemic.
Had delays in supply. To give you an example, we work with railways, and we needed sleepers made in Europe in a plant, in an European plant. We needed something like 560,000 sleepers, and the plant was located in Bergamo. And if you remember, Bergamo was one of the most affected cities by COVID in Europe. And that provoked significant delays in the arrival of the sleepers here. But without a buffer stock, if you have a buffer stock and if you use it, you can reduce delays using buffer stocks. But also the plant in Bergamo adjusted its production level, increasing the number of shifts in order to meet demand. There is no doubt that everything was impacted by COVID. There were delays in supply in the supply chains, and there were also higher transportation costs because transportation was not as frequent to certain regions of the globe. But solution for these issues are corporate solutions. We had higher costs, lower production than estimated originally, and we had to make up for it. We had to improvise. This was the consequence, the logical consequence of the problems caused by COVID-19. Thank you, Danielle. Michael, a different question. When you had 61% of demand reduction, I don't know what happened to airports, but how can you react? How did you react to this plummeting demand that had a major impact on airports? Did you have to make changes to concessions? Did you ask for more flexibility from governments in order to allow for the continuation of operations? Well, lots of questions. Let's begin with the aviation sector that was greatly impacted. And in our group, we felt the impact for several months, and that means that the yearly revenue became a major challenge. It was difficult to meet obligations. But we developed a strategy, and in the first place, managers did their homework, and operating costs were reduced by two-digit numbers. CAPEX was phased out, and we had some programs in Frankfurt. The German government allowed for it. That is to say, almost 85% of the workforce was involved in these efforts, but that didn't apply to the finance department. We were very busy trying to generate cash. And it was very difficult in the beginning. We couldn't use our facilities for other things, but we appealed to the banking market, and we were able to have gains thanks to banking policies. And we could survive. There were not many changes. There were 15 banks that were stable, and we knew that we needed a partner. During the Lehman crisis, the banking industry was involved. We supported some banks, and we knew that they were in a bad situation, and we always tried to be good partners, and the bank returned.
But it's given me sleepless nights. So therefore, we were able to structure it in a way so that we do not have it just 364 days or so. No, not at all. So during the last transaction, we saw demand also for 10 years and even longer. So therefore, the investors, so they know that aviation is recovering quickly. And just to give you an example, as you might know, we own the Greek regional airport, which is a tourism destination. And in some periods over the last weeks, we had, compared to the pre-crisis numbers, 150% more than that. So tourism is more or less back. So let's wait and see what the Omicron variant is bringing. But we know that the tourism sector is stable and it's recovering quickly. So we see the same in Antalya, where we have 50%. And so all these tourism destinations are just wonderful these days.
Thank you, Michael. Yeah, no, absolutely. I think we've seen that recovery in a number of other tourism projects that we've seen. So that's good to see and good to support. In the case, just jumping to Danielle for 1 second. Danielle, in your case, did you see any changes to any of the construction agreements that you've been working on, or any kind of contractual changes as a construction, like an EPC contractor, that you required to allocate the COVID risk? Was that something you were able to negotiate?
Well, the quickest answer is no, that the contracts had force majeure clauses with all the actors, all the parties. In the PPP contracts, so we wanted. Sorry, the sound is really poor. Anyway, as a consequence of this, we worked with a different project in situations that were managed. And we didn't have the possibility of making adjustment or to really offset the COVID effect. But there was some leeway. There were some delivery peaks. I apologize for the poor sound quality. For instance, they accepted changing the delivery without affecting the, and as a consequence, they recognized that there would some critical supplies would arrive.
That I've seen in talking to other healthcare sector companies and hospitals specifically is that there was actually a kind of higher revenue following COVID, and that wasn't an issue so much. Has that been your experience, and how have you leveraged those new resources to help you manage this better and perhaps manage future issues that are like this?
É similar, sim.
Yes, it is similar where demand dropped a lot. We noticed what we call a recovery. First of all, there was an active recovery of the Einstein collaborators, all the physicians, to show that the moment we had to create a moment of trust, that it was safe. Several studies showed that we were going to have an impact beyond the pandemic in people's health, that would be extremely severe because some people had to delay surgeries and other important treatments in the hospitals. Well, this recovery did happen. There were a lot of surgeries, highly complex, that had to be done that were postponed. So they started in 21. In 2021, we had the peak of the second wave in March. Just to give you numbers, in the private part of the hospital, the peak in 2020 in hospitalization was about 100 patients. In March, we had 330 per day. So all these are patients that had a long stay in the hospital, very complex treatments, and together with the COVID patients, so there was sort of restrained demand, and now we're experiencing a second phase, which is interesting but very sad, which are those that patients have high complexity that are trying to find hospitals to be treated. So there was an increase in our revenue, this complexity, but I don't think this is going to happen in the next periods, and the system has to balance out. The private health plans had very good results, offsetting the service providers that had an enormous deficit. This year, because of the restrained demand, have higher revenue and better results. But who pays the service are the private health plans. They have very tight results. This system has to rebalance itself as of next year. This is going to change as the following year begins.
Thank you. Thank you for that, Patricia. And looking sort of at the impact of this, and we talked a little bit about the impact on the EPC contracts. We've seen a number of contracts that have said, for construction companies, where you have actually, they're going to actually anticipate but not even count COVID under force majeure, so that you can basically not have it covered, and it limits the liability of the sponsor in certain situations. So it's an interesting, in terms of like permanent changes that we'll see going forward. That's what I'd like to kind of shift to in this right now. And Michael, starting with you in the airport sector, I would imagine that there could be a lot of different ways you could rethink airports in the future, and perhaps even have some sort of healthcare component to an airport, given the amount of testing and quarantining and all these things that has to go on while people are in transit. Have you seen any kind of permanent shifts or new ways of thinking about airport travel, air travel, as a result of this pandemic, that you think will, kind of be permanent?
So our business, so airport is infrastructure. This is always long-term view. So the planning for airport infrastructure usually takes quite a while. Just to give you an idea, so our Terminal 1, which is still the heart of our operations in Frankfurt, was planned sometime in 1960s something. So it was inaugurated in the 70s. So it's still in operations, and it's doing quite well. I mean, we nowadays have permanent modernization issues, but I mean, this is just the reality. I think this counts for most of the airports around the globe. So I mean, this situation with Corona is pretty new. Nobody, I think, was expecting something like this to happen. And so you just have to accommodate if these things occur. So what we did in Frankfurt, for example, so they just closed, what to say, so my fitness studio. So, but these are the facilities we had for the employees. It was just locked down, and so it was changed into a vaccination test site. So, I mean, these are solutions which are possible, and how you can accommodate. And I think most of the airports around the world will have to do something like this if they are obliged to provide some services around this. So use the existing space and facilities, and just adjust, change, and be flexible. I think this is the idea. And for only if you just start from scratch, you need to consider that this pandemic situation is not just pure theory. It can happen. So nobody knows. So if it's going to happen more often, more frequently in the future as well. So then you can include it somewhere in your concept. But this counts only for new terminals and new infrastructure, so which haven't been planned yet. So, and these, I think, are not too many. And the current discussion about growth rates, what's needed in the aviation sector, will we see the same growth rates over the next years? So therefore, I think it's rather expanding programs. So then starting on completely new sites. There will be some, certainly, but the majority of the airports are still there and need to adjust and be flexible, and be prepared if some corona pandemic similar situation will occur over the next time again.
Thank you. No, that is certainly a message that at IDB Invest we have learned, the importance of flexibility and being able to adapt to what happens from one day to the next, and trying to respond to the needs of the clients, both new clients in terms of structuring new projects, but also in our portfolio where we had to fund solutions for all kinds of projects where the borrower, for whatever reason, just couldn't make the next payment, and their own clients weren't able to pay. There were all kinds of issues that our clients face. So that flexibility, I think, is the key to being able to thrive or to, successfully navigate these types of situations. And that kind of brings to the topic of sustainability and how, what is sustainable under these types of situations where you have a crisis happening, especially in the healthcare sector. Patricia, how does Einstein going forward balance the need to, you're a center of innovation and of research, obviously medical research, balance that with just managing the crisis that's right in front of you every single day, and the resources that you have to allocate?
Those are separate industries, but I do believe that Michael's words apply to the health sector. There are things that we have to apply in the very short term, even if we incorporate technologies as soon as possible. The infrastructure doesn't change that quickly, and so we know that the chances for future pandemics happening again are pretty high, and it doesn't mean we're not optimistic. It just means that we have to be ready for a situation like this. So investments, both private and public investments, have to be more proactive when designing a situation of stress as a result of increased demand. So we have to start doing, and Einstein has started doing that for the sake of the balance you mentioned, the flexibility in our hospital beds. We adapted lots of our physical spaces with equipment of intensive care, and we have to keep on making these investments so that we are able to respond to an increased demand at some point. The public sector, not only in Brazil but globally, has fewer resources to add extra patients. So the private sector has to have that in mind, that we have to expand our capacity. Future pandemics might be in our future. And another investment in infrastructure that is basic is investment in research. We see that it's critical, and that in Brazil we have neglected that. The whole world has to think always how important it is to invest in research and technology. Technology must be always incorporated so that we have a more systemic design that's smarter. We have a tripod here in Brazil, and we do that with IHI and International and American Institute. That is, we have to expand the access to healthcare, reducing costs, and that requires a smarter system. We have to use complexity according to the service needed. So the closer to the center, the more complex. And it reduces complexity as you expand that circle. You can use digital platforms to offer health services. You can have a smarter system to offer smarter, optimized services. So that's we have to be able to expand, and we have to invest in technology and research. Those are my words.
Very, very interesting comments. And one last question for you, Danielle, specifically is I know Saceem is also an equity investor. You're not just a construction company. You also put forward your own equity to facilitate these projects and get them moving. We saw at IDB Invest in particular real hesitance during the pandemic to kind of make those investments in large infrastructure projects, and a lot of projects that we saw were just sort of put on hold, and everyone stopped. What has been your kind of theory or your approach at Saceem as an equity investor? Are you being more conservative? Are you being more aggressive? what do you see as being the impact on your equity portfolio?
Saceem follows the line that started several years ago as an equity investor in several projects. In terms of COVID, we have seen a great impact on unemployment. We have people that are underprepared, and we should have projects that may impact construction in Uruguay, or construction in Uruguay has had a really good growth. We have seen a growth, although we are interested to see those projects, and we have a system called private initiative. It has presented several projects to the government, and we are paying attention to other projects that might come out in other countries in Latin America. This is a way to use labor that are underprepared. Construction has really employed underprepared labor, and this should be a need that the different governments have to satisfy, using methods in trying to drive the economies and also to reduce unemployment. So without COVID, we could reach a normal situation in terms of economy.
Thank you, Daniel. Just as I think we're running low on time. Just as a final question, I wanted to ask, if you see opportunities in following COVID. I think at IDB Invest we've seen, for example, you were talking about telemedicine, Patricia. This is something that online pharmacy we actually financed recently. What kinds of opportunities have come as a result of the pandemic?
Several, and that's the positive side of the pandemic. It is now envisioning healthcare as a hub of several services. So now there's lots of tests and exams that can be done at home. Lots of technologies were developed to provide this kind of remote service in a country as big as Brazil. Specialists will not be available throughout the whole territory, so it is key that we make it more available. Also, monitoring apps, things that can be done, monitorings that can be done remotely, always with the intention of using the right dimension of complexity as required, because the problem is seeking a high level complexity center for something that is not high complex at all. Low fever, migraine, and this person seeking a high technology center. That is what has to be redesigned, the way we offer this kind of health service, so that we can meet all the different needs. Of course, that our private sector has a deep-rooted mentality that has to change, and Einstein is a very good partner in this sense, because we are non-profit, and we have to see the different users and the different needs, because the way things are in Brazil today, it is not sustainable financially. So we need these solutions that are smarter so that hospitals and payment methods can be sustainable.
Thank you. Thank you so much, Patricia. Really interesting time. I think we have to stop the session there. I would love to hear more, but I'm so, on behalf of IDB Invest, we're so proud to have all three of these institutions as our clients, these organizations. We're really, seeing how you've all managed these crises has been really, inspiring, and all of our clients for IDB Invest. And I feel very, very strongly that investment in infrastructure is part of the solution, part of the path out of this pandemic. And so we're here to facilitate that. And we just appreciate so much the flexibility and the innovation that all of our clients are able to show, to demonstrate. And we thank you so much for participating. And we wish you all well and continued success. Thank you, everyone. We appreciate you tuning into the session.
Thank you. Thank you. It was my pleasure.
Thank you, Danielle. Thank you, Michael.
Bye. Thank you.